There's been widespread vaccine hesitancy across Europe, and in particular, I think there's been some polling out recently that's shown that 1 in 4 European citizens would not want to take the AstraZeneca vaccine. So, although I can see the reasoning for pausing the vaccination campaign in some countries, it seems a little foolish to me because it sort of suggests that there is a link, even though they're saying it's safe and we're pausing just in case. It suggests there's a link. And I think some countries, such as Belgium, for example, have gone ahead with vaccination with the AstraZeneca vaccine. I feel that the precautionary principle is a poor way of framing this decision. Normally, with the precautionary principle, you'd be concerned about actions that could have a harm that we don't know exists. But the actual downside of not doing the thing is low. The downside of this is that we would drive up vaccine hesitancy and thus decrease the amount of the population that will be finally vaccinated, which we need for herd immunity. But also, we are seeing rising cases and deaths across Europe, and this is just even the pause in vaccination will lead to deaths.
So how much damage can this actually do to the reputation of this vaccine and, of course, to the uptake of coronavirus vaccines in general?
Well, it would be hard to quantify the amount of damage that's been caused. I think it's fair to say that the European Medicines Evaluations Agency, the UK's MHRA and the World Health Organization have made fairly strong statements about the need to continue using the AstraZeneca vaccine. And I know that the European Medicines Agency will be announcing their review shortly. But in normal terms, we would seek to look for a scientific causal link between the vaccine and the harm. And even in the case of very rare harms that that might be linked to a vaccine, it's not always the best policy to withdraw the vaccine, especially when you have a disease that's killing people. So the decision then will be perhaps to give a warning to patients who are going to have the vaccine, or to look for risk factors for certain patient groups that you might wish to give further advice to.